Welcome to Beauty Spot at Splatter News. Today we are at a clinic. It is called Fresh Laser Aesthetics in Cheshire, and I'm speaking with Joanna. Hi Joanna.
Hi Sam.
Well, what we've come for today is to learn a bit about Botox, haven't we?
We have, yeah.
Because I've had a lot of questions about it, and there's a lot of viewers out there who, they've heard a lot about it, they think they'd like to, have some treatments, but they're not certain. So I'm going to ask quite a few questions.
Okay.
See if we can give the viewers as much information as possible. So Joanna, exactly what is Botox? I've heard it's botulism. Is that so?
Okay. So Botox is a form, it's called botulinum type A, and it is a toxin which is injected into the skin and it reversibly paralyses the muscle. So it is a toxin.
So it is a toxin?
Yes.
It really is a botulism?
It really is.
Okay.
Yeah.
And is it that actual toxin that gets into the muscle, and does it kill it or does it just damage it?
It temporarily paralyses the muscle movement. So Botox will treat the frown lines that are caused by moving the muscle, so by frowning.
So that's why the muscles stop moving and we stop seeing the lines here and here in certain areas.
That's right, yeah.
Fantastic. Could this possibly get into a person's bloodstream?
When we inject the Botox, we do it very superficially into the subdermal, and it's into the top of the muscle. So
it doesn't go into the bloodstream?
Not going into the bloodstream. We also feel for muscle movement, so I would be feeling your face, getting you to frown, feeling where your muscles begin and end. So we're injecting into very specific areas, which is why it's really important that somebody knows the layout of the facial anatomy and where the muscles are and exactly where to go with the needle.
Is that why the governments have now said that they want only medical practitioners to be dealing with Botox treatments?
It is really important not just to use a template and just to go straight into any area of the face, because you do need to be careful.
That's quite scary when you think that some people are getting this product off the internet and self-injecting or injecting friends.
Absolutely.
So what are the possible side effects of Botox that doctors should, or nurses like yourself, should be telling their patients?
Obvious things to look out for are, you can expect to be a little bit bruised sometimes after a treatment, especially around the eye area. It's quite delicate. Sometimes you can have a heavy eyebrow if too much product is injected into this area at the top of the head. And sometimes you can get something which is quite common, which is known as spocking. So you'll have a Dr. Spock eyebrow.
Eyebrows, the ones that go. I've seen those scary eyebrows.
Absolutely. And
I'm terrified of them.
Don't
want that to happen.
We don't like
that won't be happening.
We don't
Not
like
to me.
That. No.
Okay.
So some of these things can be corrected, and some of these things can't be corrected, and you have to wait for the product to wear off. So there are.
Can the Spock eyebrows be corrected when it's gone quite wrong?
Yes, they can. Yeah.
So you could go back to your medical practitioner and say, look what you've done. This is how it's gone wrong. You need to correct this. That's
why it's really important to see somebody 2 weeks after the treatment and have a look at how the product is taken, and if there are any uneven. Sometimes everybody has some asymmetry on their eyebrows, so you may have one brow slightly lower than the other, and sometimes the Botox can exaggerate that. So it's really important to get that right, have a look at the person and make sure that everything's looking nice and even. So when a person has noticed, is it almost 2 weeks after the initial injections, that parts of the face are moving upwards and they're getting kind of like this Spock look going on, they can go back to their practitioner and say, right, I know that this can be corrected, so we've got to bring this down. Do they have to pay extra for that? They shouldn't do. That should be part of the initial treatment, and it is really important for somebody to feel that they can go back to the practitioner and just get everything checked out, and there shouldn't be any extra cost.
Because I have to admit, I have had treatment before. I'm not a Botox virgin. And when I had my first treatment, nobody ever said, come back in 2 weeks for us to have a look at you. So I was quite thrilled when you had said that to me.
Right, that's good.
And I thought, wow, someone who I know is going to be making sure that when I have little bits and pieces done a Botox, it's not, going to go wrong. And if it does, you're going to put it right. So then I feel a lot safer.
Yeah, it's really important to see somebody and make those tweaks, the necessary tweaks. And sometimes there are things that can go wrong that can't be put right, but having said that, it's still really important to check that person out and just make sure that we've done all we can. So
Jo, I know that Botox can get rid of the lines here and here. and it's quite good at getting rid of some here. And the little bunny ones that come here.
Yeah, really good for that.
That's
trick.
fabulous.
Yeah.
Can it do anything for here or down here? Any of this area?
Okay, so here you're talking about what we call a nasolabial fold here, and the
Yes.
marionette lines here. That is where the lower part of your face, the dermal filler, comes in. So Botox really
It doesn't
would
work.
not do anything for that. So you really need a nice product of dermal filler which is injected under the line and literally plumps the skin out from underneath.
Right. So we're not going to be doing dermal filler today, sorry. That's going to be in our next episode.
Okay, yeah, coming
So
soon.
we're just today are going to concentrate on what we can achieve with Botox. So Jo, now we're ready to have some treatment done. We'll move over into one of the treatment rooms and you can start your magic.
I'll be gentle.
Thanks. So here we are in the treatment room, about to have Botox. A little bit nervous, but before we get started, I just wanted to ask Jo a little bit about your background and how you got into the aesthetics of medicine.
Yeah.
Because I know that you were originally a nurse, were you not?
That's right, yeah. So to do any kind of injecting, anti-aging, injectable treatment, you must be a nurse, a doctor or a dentist.
Right.
And you also must be been qualified as a nurse for at least 3 years post-grad. So after, I don't know, 10 years or so in mental health nursing, I decided maybe it was time for a change. So I went and did my aesthetic training.
Right.
And here I am now. So 4 years down the line, obviously, you know, you need to get a lot of experience and you do a lot of practicing on friends and family before you let loose.
Do you think your friends enjoyed that?
I think they smiled politely.
Do you ever have any big mishaps in the beginning of starting it and then figuring out how to correct it?
I think, yeah, I think in the early days, the most daunting thing is the nerves. You know, it's very scary to inject somebody's face, and that was probably the most daunting thing. But with anything, you know, you have support and you have mentors and you have people's brains to pick, and you know, practice makes perfect. Yeah,
it certainly does. So Jo, a couple of weeks ago, we did my forehead area.
Yeah.
And whacked out some of those nasty lines, and especially in here, there's a few there.
Yeah.
Now I'm back from my 2-week checkup.
Yeah.
And I'm concerned about the ones on the side here.
Okay.
And what we can do about these.
Okay.
And I'm thinking that we have to just put a bit more.
Yeah.
I don't know what
Let's
to
have
think.
a look. Do me a nice big smile. Okay. And let's just have a look at the side. Yeah, I think we can put a little bit more in here. What we've done on the first dose is being quite cautious, because what can happen if we put too much product, if you just want to smile for me. Sam's got really nice high cheekbones, and what can happen sometimes if we put too much product here, it can drop the cheek muscle a little bit and give you a very flat looking smile. So to avoid that, we've been cautious and we've stayed quite high. And now we're seeing what we're left with. So we're going to pop a bit more in again, but we're going to be cautious again and not go too low, because we want to keep these lovely cheekbones and we want to keep the really nice natural look.
Super. Well, exactly what type of Botox is this? Because I've heard there's different types.
Yeah.
And you always hear about dye sport. I think in Canada that's what we call it, the dye sport. Botox.
I think in this country we call it Dysport. That's what it's known as, but it's the same. It's the same drug. There's lots of different manufacturers of botulinum type A. The product that I favour is called Azure, which we can see here. It's made of very similar compounds to Dysport.
So it'll have the same effect and same sort of strength.
It will have the same effect. And what's really important is it's diluted with bacteriostatin, which is sterile water.
What does that do?
That actually gives a carrier to the product, because as you can see here, the actual botulinum is a powder form, you see.
Oh,
okay. So we mix that.
And that's the actual botulism.
Botulism there.
Toxin.
Yeah, that's the toxin.
It's a bacteria, right?
Yeah.
Yeah.
So we mix. So we're mixing this with some sterile water, obviously. That's also quite nice and comfortable. If we just mixed it with normal saline or something like that, it would be quite stingy when it was injected and would make your face quite red and be quite uncomfortable for you.
So can you tell me a little bit about baby Botox? I've heard celebrities talk about it and they say, oh, you know, I'm not gone for the, you know, the heavy duty stuff and go for baby Botox.
Yeah.
What is the baby Botox? Is it a different type of Botox or diluted type of Botox?
It's a real buzzword at the moment, baby Botox, and a lot of celebrities are talking about, oh, I'm not having Botox anymore, or, you know, we've given up on Botox. What they've actually done is just cut down a little bit, and it's much more fashionable now to have a natural, soft look than the harsh wind tunnel look that perhaps we think about in the 90s. That was very popular. So baby Botox is using either a smaller amount of product or a more heavily diluted amount of product. But either way, it's just about being a bit more conservative with the dose. And it's also really good for patients that are a bit nervous about having Botox, they've never had it before, and they're perhaps looking for a way of dipping their toe in the water.
And just test it and see if it just
Absolutely
softens out some of the lines, but keeps some of them not completely gone.
It's nice to have some expression.
Great. Okay, super.
Hey Sam, so we've already sterilised the skin that we're going to inject around the eyes, and what we've also done is I've asked you to smile, and we've marked out with a pen the areas where we can see the ends of the crow's feet, and you've looked and we've seen that you're happy with where we're going to inject.
Yeah.
Okay, so we're going to, if you do me another smile just to be absolutely sure, we're going to go here, 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 here. I'm actually going to put 40 units in on this side because this has been a little bit stubborn. And the same on this side, if you just do me a lovely cheesy grin again here, we just marked out the area that we're going to inject, okay? And what we've also done is we've taken a before picture, and then we can see you again in 2 weeks' time, and we can take an after shot as well.
Okay,
so
super.
If you're ready, we'll get started. So I just want you to relax for me.
Okay.
And just...
Did I squeeze my hand last time? I think I do. I do squeeze my hand.
Do you squeeze your hand? So whatever you feel...
A bit of a baby about it.
Absolutely. Whatever you feel comfortable with. But before you know it, it will be done.
Okay, super.
So just do me a lovely big smile again. Okay, I'm just going to push the skin up here, and this is the first area that I'm going to go into here. That's it. Okay, that's one. Well done. Okay. Okay, and that's one done. Okay. So I'm just going to get a little bit of gauze for that.
It wasn't too bad.
That okay?
Yeah.
Not crying, no tears yet.
No.
No. She's being very brave.
Yeah.
Okay.
It was because the camera's on. Last time you did it, I was a bit of
That's
baby.
right. So you just feel...
I did a bit of ow, ow. But I'm very conscious that people are watching, so I'm like, yeah, I'm a big girl now, I'm a big girl.
She's being very brave. It doesn't look
I'll
like...
get a sticker after one time.
Absolutely.
If you're brave after Botox.
Yeah.
A brave after Botox sticker. That's what I deserve.
We should get some of those, shouldn't we?
We should.
Definitely.
Why not?
Definitely.
Walk out, stick it on me, and...
So you've got a tiny little bit of blood oozing here, but we're just going to put a tiny bit of pressure on there, and I don't think you're going to have any bruises there today at all. So that's lovely. Okay, and then we're just going to do the other side.
No pain, no gain.
No pain, no gain.
That's it.
Okay, so we'll do the other side now. So if you want to just relax for me again, do me a cheesy grin, smile, that's it, that's lovely. Okay, and then we're just going to go into this one here. Well done. Okay. That's very quick. Okay.
Now this is the side that always takes better. The left side always does much better than my right side.
And we've not put as much product into this side today because we don't need as much on this side. Okay. And what we always say afterwards, after the treatment, is to be really careful not to rub the eye area too much because we've injected into specific muscles. So not to rub the eyes, and tonight when you remove your makeup, just be really gentle.
With the cleanser.
Yeah. Not to bend.
And moisturising too,
absolutely.
very gentle.
Yeah, just be really, really gentle. And also not to lie down for 4 hours after the treatment as well. Not to lie flat, okay. And also, you're going to be really upset about this, but I'm also going to say to you that you can't go for a run today either. You can't go on the treadmill or do any exercise.
No exercising today.
Yeah.
So is it just eat cake day?
Absolutely.
Because I've had Botox.
Absolutely.
Do I have to do the facial exercises that you used to have to do back in the 90s?
I think really it's just use your normal range of facial expressions.
You don't have to do the big...
No, you
that
don't
they used to say that you used to have to do in the 90s or...
They did used to say
yeah, you used to have to do these big exercises and so that's not a big issue now.
Some practitioners still recommend that. I don't really find that it particularly makes, you know, that much difference to the way that the product tastes. So I'm just going to now just quickly clean off the little marks that we made with the pen,
Mm-hmm.
just to make sure that that's all fresh. Okay.
And I will have these little lumps come up.
Absolutely. So these.
I've been to the shops after, you know.
Yes.
When I had it last time I had it done, I have these funny little spots everywhere, and people look at me like, "What's wrong with her face?"
Little blabs. But I
didn't care because I was like, "Oh, it's going to look good in a couple of weeks. I don't care."
Absolutely. And they're usually going to stay on your skin for about an hour or so after the treatment, and then it will just settle into the skin.
I can see that there is these little raised bumps where you've injected, and you said that's going to go down in just a couple of hours, right?
Absolutely, yeah, probably in about half an hour to an hour or so. They're just going to settle down. That's just where the product's just starting to just bed into the skin. But what I'm going to do for you now, just so you don't feel too self-conscious, because you might have to go and do your shopping or do the school run or something like that, is I'm just going to dust a little bit of makeup on. And it is absolutely fine when you've had a procedure like this to wear makeup, as long as it's mineral makeup and it's a clean brush.
Okay, so not a foundation.
Yeah, so foundation. A nice clean mineral makeup with a nice clean brush, and that will just cover everything up absolutely beautifully.
Super. It feels really nice.
Yeah, it does feel really nice.
Yeah.
We'll do a little chat about mineral makeup, I think, another time.
Yeah.
Because it's really, really lovely. And I think if you go...
We'll have that in another episode of Beauty Spot.
If you go to Sainsbury's now, nobody's even going to know.
Super. That's great. Thank you very much, Jo. That has been wonderful, and that is very informative. So today on Beauty Spot, we've learned a lot about Botox. The next episodes, of course, will cover other things like filler, which you mentioned.
Absolutely.
Chemical peels.
All the skin issues. We can talk
laser
about
treatment.
Laser treatment for thread veins on the face. We can talk about rosacea, acne, hair removal.
So please stay tuned for further episodes. Thank you. Bye.